Welcome to the Heart Smart series. I'm Whitney Tate, and joining us today is Dr. George Berberian with the SoutheastHEALTH Heart, Lung, and Vascular Center. Today, we'll talk about carotid artery disease, from diagnosis to treatment and prevention. Welcome, Dr. Berberian.
Glad to be here.
Dr. Berberian, what is carotid artery disease?
Carotid artery disease is atherosclerotic buildup in the carotid arteries, which are arteries that travel from the heart through the neck and they go to the brain. Plaque builds up at the point of bifurcation, in other words, where the artery splits into two. There's low shear wall stress around that area, and there's a lot of turbulence, and that's where the blood kind of stagnates and plaque builds up over many years. Initially, when we're born, there's not much plaque there. In fact, there's no plaque. It's a normal, healthy carotid artery, but over time, plaque builds up, and that can lead to potential strokes from those plaques. Segments of plaque can break off and travel to the brain, most specifically the middle cerebral artery, and cause a stroke.
Dr. Berberian, how common is carotid artery disease?
There are approximately 700,000 strokes in the United States every year. Carotid artery disease has a prevalence of approximately 2.5% in white Americans and approximately 4% in black Americans. Men are afflicted with carotid artery disease and stroke much more frequently than women, but women have a longer lifetime risk of carotid artery disease and stroke because of longer life expectancy.
Can you talk about what is abnormal blockage?
Sure. We describe abnormal blockage as severe blockage, greater than 70% blockage of the internal carotid artery, and that's an indication for treatment of carotid artery disease. We perform carotid endarterectomy surgery. It's a 1-hour operation where we make a small incision in the neck and remove the plaque which is in the carotid artery.
Dr. Berberian, what are the symptoms of carotid artery disease?
You can have transient blindness of one eye, weakness of one arm or one leg, as well as numbness of that arm and leg. There's also symptoms of garbled or slurred speech, which are symptoms of an early or mini stroke that may progress to an actual stroke.
Can you go over some of the treatment options?
The mainstay of treatment for carotid artery disease is carotid endarterectomy surgery. For severe blockage, greater than 70%, we recommend that operation. Medical treatment is also indicated for patients that have mild disease, less than 50%, or patients that are very high risk for surgery and are deemed inoperable, who don't have a very long lifespan. We treat those patients medically.
Dr. Berberian, can you explain how the disease can be prevented?
The keys to prevention are treatment of high blood pressure, maintaining a normal blood pressure, treatment of hyperlipidemia or high cholesterol, maintaining LDL less than 70, treatment of diabetes mellitus if someone's a diabetic, maintaining their hemoglobin A1C less than 7, completely abstaining from tobacco use. The number one cause of carotid artery disease in this particular area of the country is smoking, which causes spasm of the artery and plaque buildup, and really alcohol use in moderation.
Dr. Berberian, is there anything else you'd like to add?
I think the critical theme here today is early diagnosis of carotid disease. The Society for Vascular Surgery recommends screening with a carotid duplex study for patients older than 55 years old who have cardiovascular risk factors. Carotid duplex study can pick up plaque, ulcerated plaque in the carotid artery, can pick up severe plaque, which can be intervened on earlier so that the patient doesn't experience a mini stroke or stroke, which can be very debilitating.
Dr. Berberian, thank you so much for joining us today.
It's been my pleasure. Thank you.
For more information, visit SEHealth.org.